And for everyone that just joined us, thank you very much. Really glad to see everyone. My name is Nathan Rodkey. I am the co-chair of the Healthcare is a Human Right Steering Committee. My co-chair of the steering committee is Ronnie Shore from Healthcare for All Washington. He's not able to be here tonight. He's attending to a very important family matter, but I spoke with him today. And he wanted to say thank you to everybody for being here, and really just extend some gratitude for everyone to everyone for showing up for this meeting and for all the important stuff we're putting forward tonight. And I'm really happy to be here too, because it's a good opportunity for the organizations that are really organizing on the ground this summer to get a little spotlight and share we can all share what's important to us. So that in mind, I'm going to pass it off to our co-hosts, John and Gina. Gina Owens is a board member at Washington CAN. She is a steering committee member of Healthcare is a Human Right. She is a real change vendor, and she's a housing and healthcare justice advocate. So it's my honor to introduce Gina. John also works at Washington CAN. He is the program organizing manager, and he also is the organizing committee co-chair of Healthcare is a Human Right. So thank you both, John and Gina. Gina, take it away.
Thanks, Nathan. I want to start by grounding us and acknowledging the land that we are on. For those of us in Seattle, we're on the traditional and unceded lands of the Duwamish tribe. And beyond that, we acknowledge that we are on the traditional lands of the indigenous peoples of Washington State. We honor and recognize our brothers, sisters, and siblings of the numerous tribes and nations of this land, whether or not they are federally recognized. We pay our respects to their elders, past, present, and emerging, and we acknowledge their enduring relationship with the land and waterways and their contributions to its stewardship and conservation. And we thank them for the privilege of living and working on this land. I also want to recognize that many of us carry the legacy of stolen people on stolen land. As we pursue justice, we must honor the truth by continuing to work to understand the many legacies of violence, displacement, migration, and settlement that bring us here today.
Thank you very much for grounding us with land acknowledgement, Gina. And I have the honor today to ground us in our coalition and our purpose. We fight for healthcare justice because our lived experience motivates each of us to work to change our broken health system. Healthcare is a Human Right, as we know it. HCHR is a grassroots community labor campaign formed in 2013 to secure the fundamental right to healthcare for all individuals in Washington State and our nation. We are part of a growing movement for health justice. HCHR works toward universal healthcare in 4 key ways. First, we are fighting to advance universal healthcare through the state's Universal Healthcare Commission. Second, we prioritize equity through supporting healthcare access for all Washingtonians, including undocumented residents. Third, we are battling special interests to increase affordability through the Healthcare Cost Transparency Board, along with the Prescription Drug Affordability Board. Finally, to end with a sports analogy, every team needs a strong defense as well as an offense. So we work to protect what we have already won, such as leveling the playing field for Medicare and opposing legislation and initiatives that will lead to people losing their health coverage. The common theme throughout our work is robust engagement of our membership to move the needle forward for universal healthcare.
Tonight, we will have presentations from many of the leaders of our coalition. First, on the issue of equity and social determinants, Hawaii Elias of the Community Health Plan of Washington will be presenting on the rollout of Washington's Medicaid equivalent program for undocumented residents. Then on affordability and access, Emily, John, and Adrienne present on the work at the Healthcare Cost Transparency Board. Then on protecting vital programs, first we'll have 3 presenters opposing some of our state's bad initiatives this year. and then Mike Andrew presenting on protecting traditional Medicare. After that, we'll have a more on universal health care as Marcia Chilo of Healthcare for All Washington present on Universal Healthcare Commission and federal legislation that supports state-based universal healthcare. And lastly, to tie it all together, Michaela Romero will share an update on Washington CAN's organizing work. And finally, I want to quickly introduce Steve Bach and Sarah Leon. Steve will be our timekeeper tonight, and he'll be giving reminders at 1 minute and at time to stop. Sarah is Washington CAN's housing organizer, and she will be monitoring the chat. Many major thanks to both of you.
Now you'll hear some essential policy work and ongoing campaigns led by some of our members. First, we are very pleased to introduce Hala Ilyas from the Community Health Plans of Washington. Hala is a co-chair of the Healthcare as a Human Right Policy Committee and will be presenting on the ongoing progress to cover all Washingtonians and specifically the work to cover undocumented adults. Take it away, Hala.
Thank you. Hi, everyone. So as you can see, the policy committee is really centered on 4 of our goals. The first one being achieving universal health care, and then the next 3 being things that we want to see in a universal healthcare system. And we'll dive into some of the things that fall into these categories that we've been working on in the policy committee. So next slide. For equity, I think the biggest thing that's been happening in Washington State, which is a huge win, is the immigrant coverage expansion. Many of you might have heard of this in different spaces that you're a part of or have been advocating for it. But just a quick summary of what's been happening. This past November was the first time undocumented individuals were able to purchase coverage on the exchange and qualify for Cascade Care subsidies. And that's really important because having those subsidies to reduce premiums is essential for folks who are under 250% FPL. The other opportunity was for folks to be a part of the Apple Health Expansion Program, which is a Medicaid equivalent. And it would be free coverage for all undocumented individuals under 138% of the federal poverty line. In 2023, $49.5 million went towards this program, and then this year there was $28.4 million added. Although this doesn't fully fund the program, it was enough to start it and cover administrative costs and for 13,000 individuals to get coverage. So that was just a quick summary. But since the rollout of both programs, QHP enrollment was 2,200 individuals that were able to enroll in a plan and get Cascade Care savings. Of those 2,200 individuals, more than half of them were eligible for Apple Health Expansion. And then if folks are still interested in purchasing coverage, they're able to do that year-round by going to Washington Health Plan Finder. The other program, which applications just opened up for last Thursday, was the Apple Health Expansion Program. And that program filled in less than 2 days. There was over 11,000 individuals that signed up for coverage. And then other individuals were transferred over from different existing Apple Health programs, which is huge. And also just to note that there are still slots available for individuals who are 65 plus. So please spread the word on that. And just note that that will also fill up pretty quickly. So hopefully people can get their applications in for that by tomorrow. Next slide. So what's next for the immigrant coverage is a few different things happening. One is that there is a temporary community engagement advisory committee with 16 different CBOs that represent communities across Washington. And a few of those CBOs are also part of HCHR in this space. that space has been really important because it allows community to provide input on the program as decisions are being made and the program is being tweaked to meet the needs of the community. The other big thing is HCA is working on an enrollment management system because we know a lot of folks were denied and not able to get coverage. Currently, there's no wait list for the program, but this management system ideally would allow for rooms to expand the program and get people in. So right now, temporarily, as slots open up, individuals who were previously denied will be enrolled through essentially a lottery-based system. So we're still encouraging people to submit applications in case slots do open up. And then in the policy world, we will be advocating to secure more funding to fully fund the program and get more people coverage, and also to maintain the program year after year. And then lastly, we'll be advocating for premiums to continue to be, well, not continue, but also become more affordable for individuals since they're still pretty high. Yeah, and I think that is the quick rundown on immigrant coverage expansion. And I'll pass it to folks. I'll pass it to Emily to talk about affordability and access.
I'll take it.
Okay.
All right, so we are gonna have a brief policy discussion on the healthcare cost transparency board and some ongoing work that we have in that space. I want to can we advance the slide? I'm going to turn it over to Washington County member Adrienne Jones to start us off. She is a member of Washington CAN and a graduate student at the Evans School.
Thanks, John. Hi, everybody. It's good to meet everybody. I'm just going to do a quick overview on the health cost board transparency. So I do want to point out before I get into the data that the reason that we have these surveys and the data now is because of the really good advocacy that everyone has been doing. And so I think that it's important to talk about the data for us to be able to continue to still do good advocacy work. And with this set of data that we got from the Office of the Insurance Commissioner, and this isn't new to everybody, but the data really solidifies that Washington has increased its healthcare costs by 13% since 2016, which is almost double the inflation and wage rate. And it is because of two crucial things. It is because of vertical consolidations and horizontal consolidations. The percentage of hospitals and systems grew from 10% to nearly 50% in 2017. So 40 of the 101 hospitals in Washington are now affiliated with the 5 largest hospital systems, which are Providence Swedish, Multicare, Virginia Mason, Franciscan Health, UW Medicine, and Peace Health. Along with 15 being smaller multi-systems like the Skagit Regional Health and then Confluence Health. With that as well, health insurers like the United Health Group Optum are a big part of the consolidations on the vertical side, becoming one of the major employees of Washington, of the physicians, and expanding their control over various parts of the healthcare delivery system. So if you haven't had a chance to look at this data set, I highly recommend it because to be able to humanize the data is how we're going to be able to continue the work that we've been doing in the advocacy around this. So I will pass it to, I think, back to John or to Emily.
We're going to Emily.
Go ahead.
All right, thank you so much, Adrienne, for really setting the stage for what's happening in our healthcare system around affordability. You know, I appreciate what Hal was saying earlier about the coverage expansion, and we've worked together for so long for coverage expansions, but it doesn't mean anything if people still can't afford their care. And so that, alongside the consolidation pressures that Adrienne was just mentioning, really drive towards why we have a health cost board, which is, and it's called the Healthcare Cost Transparency Board. but we're rebranding it. It's the Health Cost Board now. Because that's what they really ought to be doing. In 2020, they were set up to manage rising health spending. And as Adrian mentioned, this mission is getting more urgent. Right, we're gearing up for the third year in a row of double-digit rate increases. I don't know about you, but I'm having trouble affording my insurance. And that's before we even get to the point of care costs. So it's getting to be really unsustainable and has been for a long time. And the cost board, at the same time as these costs are heating up, is also heating up its work. So what we're seeing right now is that the cost board has set really aggressive targets for our healthcare system as a whole in Washington, saying that we're not supposed to increase spending by more than 2 and change or 3 and change percent. Then we've got OIC coming in with the study that Adrian mentioned, and we have a new bill that got passed, thanks to everybody in this room, that adds in some additional tools that are already starting to work today. So temperature is getting hotter on the cost board, and I'll give it over to John for the next slide.
Thank you, Emily. So we're going to talk about what all of us like to get into is the action side of things. So at the cost board, there are a couple of things going on. We've got, they're working on data, price variation, spending, and profits, data recommendations for insurer, provider, and accountability, recommendations on expanding primary care. We all know that we have to increase our overall spending on primary care to get the cost of other things down. Standing underinsurance survey data and the strategic goals and rate setting. We're also at the Healthcare Cost Transparency Board in the next couple of months going to be working on the issue of medical debt. Parallel state action on the OIC affordability study part 2, which is the follow-up to the study that Adrian was citing earlier, and the OFM nonprofit tax break study, which we're expecting in October of 2024. Next slide, please. And for the ongoing steps, thanks to HB 1508, we were able to get some additional seats for consumer advocates, organized labor, and small business in the space. Emily and our member Adrian earlier are the consumer advocates. And we want to engage the Healthcare Cost Transparency Board with our membership. That's one of the biggest impacts that we can have as an organization is bringing patients into the space to balance against industry. The next Healthcare Cost Transparency Board meeting is Wednesday, July 30th from 2 to 4 p.m. on Zoom. If you have anyone in your membership who is ready to share their story to move the ball forward on healthcare cost transparency, just reach out to Emily or myself. Our emails are right there. Stories about medical debt and unfair hospital facility fees will be the most relevant, but we can make anybody's story work if they're willing to share. And stay tuned for the sign-on letter in July. I'm going to have Emily say a little bit more on that piece.
Yeah, so what we know is coming up in the cost board is there's a lot of energy. Sometimes we've got these sleepy boards that don't really want to do anything. No, this board wants to do things, but they need people power to support them. And so what they have really asked for is feedback from consumers about what we want to see them doing. And John mentioned a little bit, they are interested in all manner of things all along the policy spectrum, everything from attacking medical debt to getting at much deeper solutions like rate setting. And those are topics that are being discussed in the board meetings. So what we're hoping to do is put together a sign-on letter that helps inform some of their direction for over this interim, because they are kind of focused on their strategic plan right now. We know that the next couple meetings, as John said, they're going to be talking about medical debt. They're going to be talking about hospital facilities fees, which really are the tip of the iceberg for the problem. And they know that. And we need to be highlighting both the ways that the system is making us all suffer now and also pushing them towards more aggressive solutions. So do stay tuned there, because I think we're going to have a fun summer with the cost board. Okay, unless anything further on that, and I know Sulan has also joined the cost board. And so I don't know, Sulan, if you would want to jump in and add anything. Sulan's just joined the cost board advisory committee with the rest of our rabble rousing crew.
Hey, I don't have anything else to add, but I really appreciate being here, and I'm so excited to be shoulder to shoulder with y'all on the cost board.
Okay, thank you so much. Okay, well, happy to talk to anybody about the cost board, but it's not the only exciting board in town. Let's talk about the Prescription Drug Affordability Board as well. Okay, so this is another one that is going to get pretty spicy, I think, in the next couple of months. Remember, the Prescription Drug Affordability Board was established in 2022 to mitigate unwarranted prescription drug prices. So the healthcare cost spending board is supposed to look at the whole thing. This one is about why are our drug prices so high, and not just investigating that, but they also have this really amazing ability to put an upper payment limit on the amount that we will pay for high priced drugs that have unwarranted price increases. That has never been seen in Washington before. It's actually one of the strongest prescription drug affordability boards in the country. Ronnie Short, who's not here today, has been really involved in working on this, but he can't be here, so I'm going to try to do my best to talk a little bit about it in his stead. So what do we know about what's happening with prescription drugs? Well, there was a new report that just came out last week, cited in the Wall Street Journal, from the Pharmacy Association, that really dug into what's happening with some of our prescription drug costs. One of the takeaways, it's interesting, the full report is interesting, but one of the takeaways is that there's been a 30% increase in costs for Washington employers in just 3 years on their prescription drugs. Well, our employers are the ones who are often giving us health insurance. So what's happening for us? They're passing those costs along to all of us. It's limiting our wage increases. It's limiting all the ways that our economy can be driving. So, whoa, 3 years, that's huge. What the PDEP can do is start to put a stop to some of that. It's able to, under the statute, identify up to 24 drugs a year for affordability reviews to take a look at why they're so expensive. And then actually set that upper payment limit that I talked about for up to 12 drugs a year. They are getting ready to do some of that. So they're starting, they're starting right now to put together criteria for the drug affordability reviews, like which drugs will we pick for drug affordability reviews. And we've got some models from other states like Colorado that have done that already. They're forming their advisory committees. Hopefully our good friends like Ronnie and others like Jim Freeberg and the Patient Coalition of Washington will get to be on that. So we have good consumer voices. And then they're going to pick drugs for the affordability reviews as soon as this fall. So that means if you're taking a high cost drug that you feel is unfairly priced, this is a really good time to be putting in comments to say like, hey, my whatever, insert your drug of choice, or not choice, because you probably have to take it, is astronomical, and this is a really good time to be identifying those drugs, because the state is going to have to pick a couple to start with, and there's some strategy involved in what we pick, I think. Then there is also, I'm skipping around a little bit on the slides, but not to play favorites. There are more than one areas of the pharmacy world that need intense reform, and another area that needs intense reform is around pharmacy benefit managers. Those are those middlemen that act kind of in the middle of the pharmacy and the insurance company and play an opaque role in setting prices for us all. There's a bill that passed this past legislative session that will have the OIC step up regulatory involvement in those entities, and rulemaking will start on that summer. So we should have a hot pharmacy summer and fall. Okay, next slide. I already talked about it a little bit. This is another one where there's really a lot of need for patients to be, patients, consumers, all of us to be, sending in policy recommendations, but also just like plain telling our stories, because if you watch those meetings every time for both the cost board and the prescription drug affordability board, industry is there every single meeting with a letter about this is bad, you shouldn't do this, da da da. Well, the only thing that powers the agencies to get through that is us saying, hey, remember us, like we're at the core of what this is also supposed to be about. So Ronnie wasn't here. I hope I did okay for him, and do stay in touch with Ronnie about next opportunities for the PDAP. And with that, I will pass it over to our friends
Thank you, Emily. You did an amazing job in Ronnie's stead. Gina, if your connection is better, you can introduce the bad initiatives.
Thank you, Emily, Hawa, Adrian, and John, and Sulan. Now to highlight some of our work in protecting valued programs. I'm happy to introduce Libby Watson, Molly Keenan, and Samantha Casney. Libby is working with No on I-2124, Protecting Washington Cares. Molly is working on No on I-2117, Protecting Our Climate. And Samantha is working on No on I-2109, Protecting Funding for our state's vital programs. They're here to raise awareness of these billionaire-funded initiatives and let you know how you can get involved. So let's start it off with Libby.
Hi all, thank you so much for having me. I am Libby Watson. I use she, her pronouns, and I'm the campaign manager for the No on 2124 campaign. As was said, one of the three very harmful initiatives attempting to undo progress made in our lovely state that is in so many ways leading the nation. And this is just one example of a first in the nation program that Washington passed and has continued to improve upon. And this initiative would take away long-term care benefits from millions of Washingtonians. And you can go ahead and go to the next slide there. And so we're really, really proud of our growing list of endorsers. I heard you mention Ronnie Shore and Jim Freeberg, both of whom have actually helped us gain some of these endorsers whose logos are shown here. And the numbers that I have on that left-hand side are actually even higher today because I put these slides together yesterday. So we have almost 120 organizations that have signed on to oppose the I-2124 and 170 some individual healthcare professionals, largely brought to us by the Washington Physicians for Social Responsibility, because those healthcare providers know how important it is that we provide more options for people to receive long-term care that is currently so hard for most Washingtonians to access. And we're really proud of all the nonpartisan and the breadth and depth of supporters that we have, and those patient advocacy groups like ALS Association and the National MS Society. And as of yesterday, the Planned Parenthood as well. You can go ahead to the next slide. And these are just some reasons why so many organizations and individuals have signed on to support. It's not just about our wallets, our bottom lines, our budget, as our opposition will often make it sound. It's really about care. Long-term care is something that none of us want to have to think about, but unfortunately, 70% of us will need it at one point or another. And for most of us, it's a really personal and emotional issue that is about care. It's about love. It's about having more options to take care of loved ones, because it can be really heartbreaking to either have to put someone in a home because you can't age in place like most of us want to, or have to leave your job because you choose to take care of a loved one or you don't have any other options. And that's what this program that this initiative is starting to take away poses a threat to, is giving us more options to take care of our loved ones. I'm going to fly through these next few slides then and skip the last few. Thank you. So I want to talk about some of the main points here. Like I said, it's going to take away benefits from millions of Washingtonians. It hurts working women the most, and you won't hear our opposition admit that, but women more often than anyone else have to provide unpaid care and act as caregivers. Many leave their jobs either completely or have to cut down to part-time. And right now, there are more than 800,000 Washingtonians providing 770 million hours in unpaid care. And I-2124 will make this crisis much worse by eliminating the program. And women are also discriminated against by big insurance, which charges women up to 70% higher premiums than men. You can go to the next slide. This initiative also will increase our out-of-pocket costs and throw us back into the broken insurance market, which has been failing us, and that's why we created this program. It also denies people with pre-existing conditions, which is about 57% of people over the age of 50. It also will force people into bankruptcy because of the insane cost of medical care, and medical debt is already one of the biggest problems facing us in this country. And only the super rich can afford to pay out of pocket for long-term care. And it is no coincidence at all that the super rich are the ones that put these initiatives on the ballot and are opposing this program and supporting the initiative. And I'll just kind of fly through the end here. And thank you for your time. Please do feel free to reach out to me if you want to know more about the program itself. Of course, I was focusing on the initiative, but this is a wonky policy piece that is still very much in the rulemaking process. So we're happy to answer questions, happy to take meetings, and you can support by endorsing as an individual or as an organization if you haven't already, and help spreading the word. And my email's on the last slide of my deck if you want to share that. And please do feel free to reach out to me with questions or ask for a meeting. Thank you.
Thank you. Molly, are you ready?
I am.
Great.
All right. So I am Molly Keenan. I am with the No on 2017 campaign, which is to fight against the repeal of the Climate Commitment Act. And we are doing this to protect our air, water, forest, farmlands, jobs, and transportation. Next slide, please. I'm going to go really fast through this, but kind of like Libby, if you have any questions, feel free to reach out. I will drop my email in the chat here shortly. The 2117, if repealed or passed, would impact every corner of Washington state. It is billions of dollars in funding would be cut, and we would see impacts from everything from healthcare and quality of healthcare to wildfire prevention. Really encourage people to check out a site called, and I'll also drop this in here, it's called The Risk of Repeal. You can go down and you can dive into what programs will be impacted in your communities, as well as various different sectors: bridge, roads, transportation, salmon, culverts, etc. Next slide, please. All right, so the top line overview of 2117, if it were passed, we cannot afford it. It would absolutely allow more pollution in Washington state and would be shifting the burden to disproportionately impacted communities and workers and families. It will end an immense amount of public investment in across the state, but especially in tribal nations, as well as I mentioned, disproportionately impacted communities. And then we know that we will see cuts to wildfire prevention and transportation. I kind of already mentioned that. And how it does that is it repeals the Climate Commitment Act. Next slide, please. So why does this matter? It matters to so many people. We know that we have one of the largest coalitions. The other campaigns also have a tremendous amount of support, but we have one of the largest coalitions of organizations with over 250, and that is growing. I would say that we are probably adding 5 to 10 new organizations now a day, depending. And it spans from labor unions to environmental groups, to community organizers, to agriculture. We have such an immense reach, and that is truly because CCA funds go into all of these associations and organizations. So everybody has a lot of skin in the game. Should this be repealed, and we see that tremendous amount of cuts across the state. Next slide. So what we know is we do have a winnable race, but it is a tough fight ahead. So we have done extensive polling. We are a data-driven organization that is taking that data and then turning that to see how we can actually do persuasion. So our polling shows that we do have a path using persuasion, but many voters are undecided. And to do that, we need to be able to reach them. And part of the issue is that our messaging and all these impacts are very complicated. How CCA funding impacts agriculture is very different than how it impacts us reducing pollution, which can reduce asthma rates. Versus our opposition, which has a very simple messaging. And so while it's misleading, it resonates. And so that is why we have a tough road ahead, but we do know that with the strong support that we have via our very large coalition, we can actually do this, but we need to make sure that we are on message and talking to everybody. Next slide, please. So our plans to defeat it. We are going to continue to grow our coalition, building grassroots support. I would encourage everyone here to go sign up to pledge to vote no. Like I said, I'll drop these links in here in a second. The larger our coalition, the more we minimize our opposition, and then we also will be able to raise the funds that we need to win. I already mentioned data-driven communication, and the best part of this too is I get to work with Libby and Samantha, who you are going to hear from shortly, because we have a very strong coalition amongst these three initiatives in the Defend Washington. Next slide, please. All right, so this is a 30-second version. I am going to actually skip over this because I know I only have 1 minute. I feel like I've kind of covered all of these things, but impacts pollution, devastates funding for programs, and our broad coalition is essentially what we are going to use to make keep Washington beautiful and a place to live and work. Next slide. Endorse, yeah, and then I'll drop all these links in the chat just so that we're keeping tight on time. The one other thing that I just want to mention quickly, and I should have mentioned this at the top in the first slide, is that specifically, and I know that this is a community that is deeply passionate about the healthcare of all Washingtonians. And specifically, we know that cuts to clean air, air quality monitoring, and asthma prevention is what is going to be significant towards the health of all of our individuals. We will also see cuts to funding in modern, cleaner schools, buildings, wildfire prevention, I've already mentioned, cleaner transportation, and all of this will be reducing health disparities in overburdened communities. So just to really kind of tie the dots for this specific community, it impacts everybody, but I just wanted to make sure that you're aware of that. And with that, I will hand it over.
Samantha, you're on.
All right, and I'm the final presenter. Is everybody confused yet by all the numbers? So I'm with the No on 2109 campaign, and you can go to the next slide. Ours is to repeal the capital gains tax, so we are no on that. So basically, I'm here to say to you that voting no on 2109 means voting no cuts to education. We don't want any cuts to childcare, and we don't want any tax breaks for the mega millionaires. So we're a pretty straightforward campaign. You can go to the next slide. So I want to tell you a bit about the Washington's capital gains tax, and that's what Initiative 2109 is dealing with. So the capital gains tax passed the legislature in 2021, and so now it is going before the voters. So the capital gains tax that we are talking about in this initiative is just a modest 7% tax on the profits of $250,000 or more from the selling of stocks or bonds. So it turns out only 0.2% of Washingtonians pay this tax, which is less than 4,000 individuals in our entire state. And they are the wealthiest of the wealthiest people. There are many, many exceptions written into this law, including all retirement accounts, real estate, farms, small family businesses, many more. So it really is just targeting the sale of the profits of stocks and bonds. Moving on to the next slide. Just really want to hit on what's at stake with Initiative 2109. So 2109 is basically a tax cut for fewer than 4,000 mega millionaires and billionaires in our state, most of whom actually live in King County. And I bet you even can guess where they live in King County, because when we all drive across I-90, we kind of see those really lovely homes, right? So if passed, Initiative 2109 would take away over $5 billion over 6 years from Washington education and childcare. In 2023, the capital gains tax brought in almost $1 billion just in its first year alone. And that money went directly to childcare, early learning, and K-12 public education. And you know, I think for you all just to know, when we all go down to Olympia and lobby for certain things, there's just one pie. And if this initiative were to pass, we're all going for a little bit lesser of the pie, you know? So I think it's important to keep that in mind as we're talking about this or any of the other initiatives. If we start taking money out of the pot, we're all going to be impacted and won't be able to work on issues that some of us really care about. We know the opposition likes to talk about how the capital gains tax is volatile and maybe isn't reliable. We just had new numbers come out last month. It brought in an additional $433 million this past year. And I think We knew the capital gains tax would be an unpredictable revenue source and it's prone to up and down swings. That's just how capital gains work. So it's not unexpected. And we know that bringing in this money just means more families are getting the help they need paying for childcare. More public schools are getting the resources they need, and we can pay for school construction and repair projects. So if we lose 2109, we lose billions of dollars over 6 years. Schools are already facing budget shortfalls. We see that in the news almost daily at this point. Families across the state are struggling to access childcare and early learning. This would just set back our movement to fix all of these things, plus our upside down tax code. And we just simply can't afford to lose this battle. So on to our next slide. We have a lot of polling that's out from Defend Washington and others showing that only 31% of Washingtonians say they support repealing the capital gains tax. A majority of Washingtonians, 56%, are opposed to the initiative. And I think that's because they see it for what it is. It's a tax break for mega millionaires. And on to my final slide about ways you can help and get involved. We have a growing coalition, so I would join with Libby and Molly just to say endorse. We're looking for all the endorsements that we can get, continue to grow our coalition. Our social media is up and running. We encourage you to like us and follow us and share out our content. You can also sign up for updates directly on our website, which is no2109.org. My email is on the final slide, so if you have any other questions, feel free to reach out as well. And we look forward to working with you on this fight and appreciate your time tonight.
Thanks, Samantha. John?
All right, at this time, it's my pleasure to introduce Mike Andrew, representing Puget Sound Advocates for Retirement Action. Mike is the Executive Director of PSARA and is here to discuss the work happening to level the playing field for Medicare beneficiaries. Take it away, Mike.
Okay, thank you. First, I just want to express PSARA's appreciation to HCHR for taking up the fight against these 3 destructive initiatives, which PSARA is also involved in, and for joining us in the fight to level the playing field between traditional Medicare and Medicare Advantage. PSARA has been working against privatization of Medicare since, working consistently and hard against privatization of Medicare since 2020. If you remember, then the Trump administration introduced what they call DCEs, direct contracting entities, and then the Biden administration rebranded those as ACOs, Accountable Care Organizations. And those allowed private entities to come in and manage people's Medicare benefits. But in the course of that, we realized that the real threat of privatization comes from Medicare Advantage plans, which in spite of the name, we all know, are private insurance plans. Somewhat more than half of all Medicare beneficiaries now have these Medicare Advantage plans rather than traditional Medicare. And we can expect that number to grow unless there are some fundamental changes made to traditional Medicare. The reason we're concerned about that is because Medicare Advantage plans allow public money in the Medicare Trust Fund to flow to private insurance companies. And we'll just switch out my mic, and that sounds a lot better. So we have Medicare Advantage plans essentially set up to raid the Medicare Trust Fund, because these Medicare Advantage plans are paid by capitation. The Medicare Trust Fund pays a fixed amount to the private insurers for each Medicare beneficiary. And then they're supposed to provide care for that beneficiary. Now, what happens? What happens is the Medicare Advantage plans go fish for healthy people. And then, even though you're healthy, they upcode you so that you appear to be sicker than you are. And that way they get more money from the capitation from the Medicare Trust Fund. For example, I have high blood pressure. It's completely controlled by chlorthalidone. My blood pressure with the meds is absolutely normal. But instead of being coded as high blood pressure, I might be coded as chronic hypertension, which means that the insurance company can get a lot more money from the Medicare Trust Fund for my care. If I really get sick, what happens then? What happens then is, the insurance companies require prior authorization for treatment. So my treatment might be delayed, my treatment might even be denied, and in any case, I have to go to physicians or healthcare providers who are in the insurance company's system, which means I might not be able to get the best care. So that's how Medicare Advantage plans raid the Medicare Trust Fund. And whether you have Medicare Advantage and whether you like your plan or not, this is not good for the overall healthcare system. The threat of privatization is also a threat to the broader goal of universal healthcare, because a lot of times we talk, 1 minute, okay. We talk here about Medicare for all or improved Medicare for all. Well, who, apart from the private insurance industry, would want privatized healthcare for all? Nobody, clearly. So the changes that need to be made to Medicare to reverse the trend towards private insurance, the thing that causes people, and especially middle and low income people, to opt for Medicare Advantage plans is price. If you opt for Medicare Advantage, you don't have to buy an expensive Medigap plan. You don't have to pay extra for drugs. You don't have to pay extra for hearing, dental, and vision. And that's the reasoning behind level the playing field. Just give people a choice so that for the same price, they can opt into Medicare Advantage or they can opt into traditional Medicare. And I think my time should be up by now, but people can subscribe to the Retiree Advocate, which is our newsletter. And we cover this every month, and we have been since 2020. So thank you.
Thank you, Mike.
Thank you, Mike. Now, as a part of carrying forward our work towards building a statewide universal healthcare system, it's my pleasure to introduce Andre Stackhouse, Campaign Director for Whole Washington. Andre is here to talk about the 14, read them and listen, 14 town halls that Whole Washington has organized for this spring and summer. Andre?
Thank you, and great to be here, everyone. Whole Washington has recently become a member of the HCHR Coalition, so we're looking to spread awareness of some of the work that we're doing and invite folks in. So this year, our primary focus is a series of town halls, and frankly, I lose track of how many we've done. So I don't have a latest count on how many we've done, but we've got at least 11 listed on our website. So you can go to wholewashington.org/townhalls to see the full schedule, but you can see that we're hosting them all over the state of Washington, and we're trying to partner with other organizations. So we had Sean Arndt from Washington Physicians for Social Responsibility in here a bit earlier, mentioning our collaboration with them, as well as PNHP Washington and Undue Medical Debt on the Healthcare Not Warfare series. So we're certainly interested in hosting as many of these as we can. And if any of you want us to come and speak to whatever it is, your knitting circle or the organization you represent, your union, your workplace, we are certainly happy to do this. So far, the series has been really great. So it's an opportunity for people to tell their stories about challenges they've had with the healthcare system, to provide feedback on the sort of universal healthcare system that they would like to see, and to really plug them into the ground level work that's going, that it's going to take. So we're really looking to get out there in the public to people who don't go to commission meetings and don't normally see themselves as being active in this, and meeting them where they are and listening to them, as well as educating them and telling them how they can truly get involved with this work. So if you'd like to help us make this town hall series bigger, better, wider reaching, please go to wholewashington.org/townhalls to attend one when you can, and hopefully organize one with us as well, which you can do at that same link. So you can basically just give us a little bit of information on an online form that'll let us know that you want to get in touch, and we will follow up with you to get that town hall scheduled. So thank you for the opportunity to share that with you all today. And please just get in touch if you have any additional questions.
Thank you, Andre Teaton, for all the amazing work you're doing. With more work by HCHR organizations on universal healthcare, I have the pleasure to introduce Marcia Stedman and Cello Echeverria. Marcia is a board member of Healthcare for All Washington and presently is chairing HUCS, our committee that engages our state's Universal Healthcare Commission. And Cello is a powerful activist who is also with Healthcare for All and HUCS. They will be presenting on work happening at the commission and also the federal work we are supporting for state-based universal health care.
Thank you. Thank you, John. Hi, everyone. And thanks for this opportunity to tell you a little bit about what HUCS is and what we do. So HUCS is a group of 7 healthcare as a human right organizations that actively works to make affordable, equitable, and accessible universal single-payer healthcare a reality for all residents of Washington State. Are we seeing the first slide? Yeah, there we are. Okay, then we can move on to the next slide. Thank you. We envision Washington as a state where all residents can seek and receive medical care when they need it. No co-pays or deductibles. Pre-existing conditions are included and covered. Any medical provider licensed in the state can participate in the state's healthcare coverage program. Everybody in, nobody out. Next slide. So what we do is we attend the monthly meetings of the Universal Healthcare Commission and its Finance Committee to track progress toward a single-payer universal healthcare plan. We develop and evaluate strategy before and after each of these meetings. We coordinate and make public comments at Commission and Finance meetings. And we present solutions to assist the Commission to achieve their goal of a universal healthcare plan with a unified financing system. Oh, and the last point, we meet with individual Commission members and legislators and others from time to time as needed. Next slide. So what have we done? What have we seen to date? Well, so far, comments and proposals by universal healthcare advocates have occasionally been acknowledged. The Commission heard a presentation on the Washington Health Trust, a possible plan framework, by Andre Stackhouse of Whole Washington, whom you just heard from, with an analysis to be included in the Commission's 2024 report to the legislature. Consensus appears to support inclusion of all state residents in the universal system, although no votes have been taken. And thanks to lobbying by healthcare as a human right advocacy organizations, 3 studies that could lead to legislation improving healthcare infrastructure in the 2025 legislative session are now underway. They are a consolidation of healthcare purchasing for the public employment, employee and state employee benefit programs, automatic enrollment into low-cost exchange plans for individuals losing Medicaid coverage, and expanding access to Medicaid for low-income Medicare beneficiaries. Next slide. We need a little bit of improvement here to move the work along, including active participation by commissioners. Some have never attended any meeting in 3 years. An explicit statement providing an overarching vision for the proposed plan, the plan itself, so that Washington can apply for the necessary federal waivers, And we need SABUCA, the Federal State-Based Universal Healthcare Act. Well, what is that? Well, Jello's up next to tell you all about it.
Hi, thank you very much for inviting me. So what is SABUCA? For a state-based system to be able to run, it needs funding. About 50% of funds of healthcare in any state run through the feds, through Medicare, Medicaid, and CHIP. So until we have access to those federal funds, it will be very, very difficult for us to do a state-based universal healthcare program, single payer or not. So SABUCA kind of closes that gap. And this year was reintroduced by Representative Rokana. It has 29 co-sponsors, thanks to the hard work of one-payer states, including 2 from Washington, Pramila Jayapal and Adam Smith. Are the slides? I forgot to say change slides. Sorry. Are we there yet? The slides? Yeah. Okay. Good. And we also have pretty exciting news that Edward Markey from Massachusetts has also pledged, with no action yet, to support SABUCA along with Elizabeth Warren as a co-sponsor. Why do we need a super waiver? Why do we need to have these funds? Well, we have the Affordable Care Act. New slide. The Affordable Care Act actually allows us to do 2 kinds of waivers, demonstration waivers and innovation waivers. But what it doesn't allow us to do is it doesn't allow us to access Medicare funds or to get around an ERISA challenge, which we believe that SABUCA would allow us to do. How does SABUCA do that? New slide, please. Or better. What SABUCA does? It mandates guaranteed healthcare coverage for at least 95% of residents in 5 years, and 95% is not 100%, so that's a real issue. It requires any state-based plan to have benefits equal to or greater than any federal plan that already exists. It must be budget neutral. It can't cost the state more than what it's currently spending. And really interesting, it allows groups of states to come together to do joint plans. For example, Connecticut and Washington State could theoretically come together and we could propose a joint plan. It also, we believe that it also minimizes legal challenges to ERISA. New slide, please. Where are we in Washington? So to apply for this super waiver, the state needs to prove that we have the capacity to run a state-based universal healthcare program. And this is why the PEB and SEB consolidation study and then the actual consolidation is really important. We invite all of us, please, to come to the Universal Healthcare Commission to give comment, both in support of the PEB-STEP consolidation study and also in support of SABUCA, because it is absolutely the surest path to fund our own state-based system. We are also asking our members to call our Congress people. We only have 2, and there's 9 Congress people total. That's a pretty pathetic showing in my book. So we got 7 people we got to get on board. And tell them why they should sponsor Rokana's bill, co-sponsor Rokana's bill. If your congressperson already supports it, Jayapal, if you're in Jayapal's or Adam Smith's district, please call them up and thank them for supporting us. Also, please call our senators and ask them to at least look at the memo that came out of Markey's office. If you'd like to learn more about the universal healthcare, about SABUCA and about what the Universal Healthcare Commission is doing, we would be more than happy to come and give a presentation to your organization. Thank you very much.
At this time, I'm delighted to introduce to you Michaela Romero, Washington CAN's digital organizer, to give an update on Washington CAN's work in the community. Michaela?
Thank you, Gina, and thank you everyone for having me here. I am very excited to give you the update from Washington CAN. I'd like to start with Washington CAN's work, bringing our members to the table to share their stories about the impacts of the healthcare system inadequacies to further reinforce the urgency of our healthcare mission. As mentioned, thanks to the expertise in the organizing efforts of this coalition, we were able to see our member Adrian confirmed to the Healthcare Stakeholders Advisory Committee, along with Emily and Sulan. Since meeting Adrian, I have been amazed by the fierce healthcare advocate that she is, and it has been a joy for me to watch her grow as a Washington Can member and to have her not only years of public health expertise, but also her years of lived experience help us move the dial. So thank you all for making that happen. Washington Can understands the deep intersectionality of the issues we work on as well. Without housing, it's extremely difficult for anyone to maintain their health. That's why our incredible field and program organizers gathered over 4,500 signatures for I-137 to fund social housing in Seattle for permanently affordable housing where Seattleites can age in place. We are also proud to be continuously engaging communities outside of Seattle by contributing over 3,000 signatures in the effort to raise minimum wage in Burien, where it's currently $3 to $4 less per hour than the surrounding cities like Tukwila and SeaTac. I'm also very, very happy to announce that both of those initiatives will meet the signature threshold to make the ballot either in November or by the special election in February 2025. Many people that live and work in the Seattle area are aware that the city council attempted to roll back minimum wage and labor protections for gig workers like Uber and DoorDash drivers, as well as dog walkers, city tour guides, all of which we know are considered contractors by big tech companies that don't provide any sort of health care to their employees. Having a deep healthcare base, we understand that many of these gig workers also take these positions for the flexibility to manage their care, and many consumers utilize these services around healthcare flare-ups. Thanks to help from our allies in the community and labor partners and our members again stepping up to give testimony, we brought multiple angles to the council to make a clear stand that the community saw through the corporate lobbying efforts to pin those retaliatory junk fees on consumers, to pressure the council to roll back those gig worker protections. And thus we successfully halted city council's efforts to deny gig workers a Seattle living wage. They canceled the vote an hour ahead. So we were very excited to see that effort through. All right, now get your pens and paper out. You're going to want to save this date. We are planning an exciting 40-ish birthday fundraiser to celebrate 40-ish years of Washington Can movement. 40 years was like height of pandemic time, so celebrate 40-ish years with us. It will be the evening of August 9th at Green River College in Auburn. More details to follow. Tickets will be going on sale soon. Please let us know if you'll need transportation assistance. We'd be happy to support. And lastly, we recently got a new website and digital action tools, including our link tree that aim to make taking action more accessible. One of the features is our community calendar. We'd like to feature your events and actions. We are Washington Community Action Network, and we'd like to help connect our community, take coordinated action, and build a really strong network. So please email John at johngodfrey@washingtoncan.org with your events, actions, and questions. Let's build a really strong network together. Thank you all.
Thank you so much, Michaela. It's inspiring to see the work that we are all doing in the community to move the ball forward for the healthcare that we need. At this moment, we want to make a note and acknowledge that we will not be featuring the winner of the Pacific Islander Health Board's Poetry Contest winner. They'll be announced tomorrow, and we'll be highlighting them in our July newsletter. Thank you, everyone, for your contributions. Last but not least, I'd love to introduce Jesus Sanchez of Seymour Community Health Centers, and he also sits on our HCHR steering and budget committees.
Good evening, everyone. Today, we have a short little note that I want to make really quick and a reminder, but it's nonetheless a very important one. It is very critical, actually, to send out a reminder to everyone. First of all, the thank you. First of all, our sponsoring organizations who have made due contributions for 2024 thus far. And our budget committee initially set the date for every year in March the 31st as the due date that we know early in the year the funds will be having to work with. We'll have what funds we'll have to work with. Basically, it allows us to plan very carefully for the rest of the year. The sooner we have the funds in it helps us then be more predictive about what we want to be able to do and set the plans accordingly. However, some of our dues pay members obviously have not yet been able to get their donations in, and would like to remind everyone to get those 2024 dues. Our policy members adopted that we adopted back in 23 for March 31st is something that we're continuing to hold, and ask that if everyone could pretty much get in your donations. We hope to transition from an early donation schedule in the years ahead. It helps if our standard donations will be sent in as soon as possible. So again, just a reminder, but really the bigger reminder is what it does. It really helps us plan ahead and stay very predictive of what we're going to do. That's really the important value of that reminder. So getting your donations in a little early to us would be very, very helpful. We're now mid-year. And again, it just, we're really just not only thankful, but also just as a reminder to thank you for your donations, but also, again, just a very important reminder to, if you can get us our donations in for 2024. Thank you very much.
Thank you so much, Jesus. We always like hearing from our budget committee people. Now, last but not least, we are into our good of the order and our closeout for the night. So Nathan, you want to kick that off?
Yeah, thank you everyone for joining. It's a little awkward with this camera here. After me, if anybody in person wants to do good of the order, please come up here. If you're joining virtually, just raise your hand and we'll call on you. And I've got one, I want to let everybody know that on July 19th, the Duwamish tribe is holding their annual fundraising gala, and that is going to be at the Mohai. Information for tickets is going to be in the chat. It'll also be in the email we send out next week. We're going to send out a newsletter, and that's not related, but I will let everybody know we are going to send out a newsletter early next week with all of the action items that we highlighted tonight. So if you missed anything, you are going to get a HCHR newsletter in your email inbox early next week with all of those details. And if anyone else has anything good of the order, raise your hand. Don't just speak now, but raise your hand and we'll put it forward for you. Wow. Silence. All right. Well, we do have a lot of good of the order already. I think that was a packed agenda, if I may say. There's Gina. Gina, yeah, please.
I just want to remind everybody, if you're going to watch the debate, watch it very interestingly and enjoy your evening.
Yeah.
Sorry, I don't understand. None of us do.
Oh my gosh. Yeah. Well, I think that's a good way to end it, unless I don't see any hands up. So, I am gonna close out the Zoom here, for those in person. If you're just nearby, near the State Labor Council building, a few of us are gonna be going over to the Wonder Bar, for those who really want to see that debate. You can see it at the Wonder Bar, but they have Ethiopian food. It's a locally owned restaurant. It's a really, really great place. I personally love Ethiopian food. So yeah, I would just say, you're welcome to join us. And thank you so much for being with us tonight. I don't really mean to be the person to wrap it up. Thank you very much, John, and everyone for, Emily, Howard, Jesus, Larry on the slide, David Lau, David McClanahan, Mike Andrews, Sarah Leone, and
Sarah from
Marcia,
chat.
Cello, Steve Bach. Thanks for coming. Yeah, everyone that joined us virtually. Thank you very much. Thanks, Adrian, Carrie, Cindy, Craig, Chris, Dennis, Hugh, Mo, Michaela, Ola, and then Sulan's still with us. All right. Thanks a lot, everyone.
Thanks,
Have a great
Nathan.
night.
Thanks, everyone.
Bye.
Thank you. Bye-bye.